Hello and good evening. Thank you very much for staying with us until this late hour. We were supposed to have this usual press conference at 11 a.m. as usual, but we had to make time for the very important virtual press conference, on Africa's leadership in COVID-19 vaccine development and access. For those of you who might have been joining us, that session was held from yesterday until today. It was a 2-day marathon of experts coming together to discuss that very subject of Africa's leadership in the development of vaccines and access to African countries. I'm sure that you enjoyed the discussions very much. Now, for those members of the media who are joining us for the first time, welcome. This is our press conference. We will run it as follows. We will start with our regular briefing on the continental situation from Dr. John Nkengasong, and he is the director of the Africa Centers for Disease Control and Prevention, the Africa CDC. Thereafter, we will have Her Excellency Amira El Fadil. She is the Commissioner of Social Affairs right here at the African Union, and she will be giving us a brief recap of that virtual conference on Africa's leadership in COVID-19 vaccine development and access. Thereafter, we will then go into our question and answer session. But before we get there, let me give you the details of how you can ask your questions. You can send your questions to this WhatsApp number, +251 945 502 310. Let me come back again with that number, +251 945 502 310. Please remember to include your name and the institution that you're working with. Alternatively, if you want to ask your question live, put it to any of our two panelists here today. Kindly write your name and the institution that you work for in the chat section on the screen, and we will recognize you to ask your question directly to us. All right, let's get our press conference started. I want to start by calling on the Director of the Africa CDC, Dr. John Nkengasong, to give us a brief on the continental update on COVID-19. It's over to you, Dr. John.
Thank you, Win, and thank you, colleagues who have worked so hard with us over the last 2 days. And very specifically, the journalists that are always with us, accompanying us in this very important journey. One of the things that was discussed extensively during the last session of the vaccine meeting was the need to work very closely with the media. And I think my answer to them would have been that we have been working with the media very closely, but we even need your active collaboration and participation, so much so in the areas of the vaccines, access to vaccines, and preparing our communities for that. I would do three things very briefly. First, give you an epidemiologic update of the situation, and then discuss what we are doing, Africa CDC is doing, and then lastly, just touch on this vaccine meeting. First of all, as of 9 a.m. East African time today, the world has seen or recorded over 9 million cases of COVID-19. And more than 470,000 people have died of this deadly virus. In Africa, the continent has reported a total of 337,000 cases of COVID-19, with approximately very close to 9,000 deaths, precisely 8,863 deaths, giving a case fatality ratio of 2.6%. There have been 161,000 recovery cases, which we always have to celebrate. Since the last briefing, there have been a 25% increase in cases, with about 67,000 new cases reported, an average of 9,000 new cases reported per day. If you recall, last week, the average number of new cases per day was 8,000, and this week with around 9,600 new cases. This week, the Southern African region accounts for 48% of the new cases, followed by North Africa, representing 21% of the new cases, West Africa representing 15% of the new cases, Central Africa 7.7%, and East Africa 7%. The 5 countries with the highest cumulative number of cases include South Africa. South Africa alone has exceeded 100,000 cases. Egypt with 59,000 cases, Nigeria 22,000, Ghana 14,000, and Cameroon 12,000. These 5 countries account for 65% of all cases reported in Africa. Countries continue to report, countries reporting the highest number of cases per 100,000 population are Djibouti, Sao Tome and Principe, Gabon, South Africa, and Cape Verde. Again, Sahrawi Republic, Democratic Republic has not reported any case. In terms of our support to countries, we continue to scale up testing, support countries to scale up their testing by providing additional trainings. As we speak, as a continent, we've tested or provided, as a continent, provided total testing to about 4.3 million people. That represents about 3,200 tests per million, with a positivity rate of 7.8%. I will just conclude then by saying that we've had a very successful 2 days vaccine meeting, which the goal, as I indicated earlier, was to enable us as a continent to develop a framework and a strategy on how Africa should position itself to gain access to vaccines, COVID-19 vaccines, once they become available. I will not go into the details of that. I know there's a lot of discussion there, but I'm sure Commissioner Mira will come in a little bit on that. So thank you, Win, for the opportunity.
Thank you very much, John. I will now invite Her Excellency Amira El Fadil, the Commissioner of Social Affairs, who will give us a brief recap of that conference that Dr. John was talking about, before we then move on to our question and answer session. Excellency, you have the floor.
Thank you very much, Fini, and thank you to all the journalists who are joining us in this press conference. I thank you on behalf of the African Union Commission. You were with us from the beginning in this fight. I thank very much DIC, all the staff of DIC that supporting these efforts we are exerting as Africa CDC on behalf of the African Union. I thank them. They are always available. They are following with us all the activities, and also they are taking out our messages and communiques. As you know, we have started our implementation of our strategy, which was adopted by the emergency meeting of the Ministers of Health, which was convened on the 22nd of February, only 1 week after the first case being reported in Africa. So I think we started early, and I commend Africa CD staff for this early start. After convening the ministerial meeting and after the adoption of the Joint Continental Strategy, it was also endorsed by the Bureau of the Assembly, chaired by His Excellency President of South Africa, the chair of the African Union. And I commend highly his leadership and the leadership of the chair of the commission, His Excellency Musa Faki Mohammed. They have instructed us, the Bureau of the Assembly, to establish an anti-COVID-19 response fund. And I would like to share with you that the fund is being fully established. We elected the chair and the vice chair of the fund. The fund now is up and running. There is pledges being made by our member states and being transferred to the 2 accounts of the fund, in the EcoBank in Kenya and the Standard Bank in South Africa. The fund is now supporting and financing different activities of the Africa CDC. And we receive requests from member states on their needs. This is one thing I would like to share with you, that it's already been done and it's in place, and we are still calling on our partners to support us by giving more resources to the fund. And we have 6 special envoys appointed by the chair of the union to do part of their job is also to go for resource mobilization for the anti-COVID-19 response fund. One thing also I consider it as a big achievement for Africa is the establishment of the medical supplies platform, which is an electronic platform. Strife Masewa is the chair of this forum that developed this electronic medical supplies platform. And this is also an achievement because through this platform, Africa and all African member states can access the manufacturers of the medical commodities needed for the fight of COVID-19. Member states are already using this medical platform, and we are proud that we did implement the second objective that's been approved as part of our continental strategy, and also about one of the 2 objectives of the establishment of the fund, which is the pool procurement for the medical supplies for Africa. We have also implemented one of the objectives, which is sending responders to member states, and this we did it. And I believe Dr. John in the previous press conferences shared with you the details about the responders we sent to many African member states, and we are still sending, and also we are recruiting more volunteers. We are recruiting epidemiologists to support our member states. In the area of vaccines, which is part of also of our strategy, is to look into the accessibility and the affordability of vaccines for Africa, and also the development of vaccines. Dr. John, Director of Africa CDC, and his staff, they have organized a 2-day conference, 24th and 25th. We started yesterday in the morning, ending this night, with a very important papers being presented with a very large number of participants. More than 3,000 participants participated in the 2-day conference on the development of vaccines. But in the opening, I would like also to share with you that in the opening, we had the pleasure to have with us the President of South Africa, the Chair of the African Union, His Excellency President Ramaphosa, and also our chairperson of the African Union Commission, His Excellency Moussa Faki, and the Director General of WHO, Dr. Tedros Adhanom. The 3 of them, they participated in the opening session, and they delivered statements, and the chair delivered opening remarks. I thank the 3 of them. Really, I thank them for their availability, for their support, because without their leadership, the political leadership they are providing us, we could have not made it this far. So they are still supporting us. They committed themselves to continue supporting our efforts. This conference is a very successful conference, and this is not my words. I'm not neutral, but this is the words of the participants themselves, that this is a very successful conference. We negotiated in this conference the opportunity for Africa to be part of the development of the vaccines, the opportunity for Africa not to be left behind when vaccines are developed in other parts of the world. We spoke about the clinical trials, whether Africa to be part of it and how to be part of it. We spoke about the efficacy and the safety of the vaccines, and we spoke about the affordability. We spoke about making sure that every member of our population in Africa can have an opportunity of having this vaccine, and we spoke about having no barriers to vaccines. Let me share with you just a few points. There is a communique. We just issued this communique maybe less than half an hour ago, and I would like to share with you some parts of this communique, and it will be provided to you as a soft copy. It will be shared with you definitely, because it is a 4 pages communique. I'm not going to read it, but I will share with you some of the outcomes in this communique. The first one I would like to share with you is that the ministers who attended, the African Union Ministers of Health and the heads of delegations who attended this virtual conference on developing vaccine strategy for coronavirus disease in Africa, they agreed to commend the efforts of Africa CDC to coordinate the implementation of the joint African continental strategy for COVID-19 outbreak and to rapidly establish an Africa COVID-19 vaccine development and access strategy, which will serve as a roadmap to better coordinate and scale up efforts across Africa. The strategy will have two major prongs. First, securing sufficient vaccine supply. Second, removing barriers to vaccine rollout. The second point, the ministers welcome the close collaboration between Africa CDC and WHO, African Vaccine Regulatory Forum, as well as other relevant stakeholders in supporting countries to strengthen their capacity to adopt and scale up a vaccine for COVID-19 once clinical approval is achieved of a viable vaccine candidate. Also, they agreed on securing sufficient vaccine supply and also to advocate for Africa to receive a sufficient global allocation for timely access to potential COVID-19 vaccine, including partnership with the COVAX facility within the Access to COVID-19 Tools Act, Accelerator Initiative, and additional support from partner countries and regional bodies. These are just a few points. Also, they agreed on removing barriers to vaccine rollout. They agreed to develop a continent-wide clinical trial network to better connect organizations who are supporting efforts to test potential vaccine candidates. They also agreed to enable an effective regulatory control structure for the vaccine, which includes implementing vaccine manufacturers, fast-tracked regulatory approvals at country level, and a robust infrastructure for ongoing monitoring of vaccine efficacy and safety. These are just a few points, but these I consider the main points in this communique. But as I said, we will share with you the communique, and I think Winnie will tell us how, but we will share it with you, all the information. And I assure you that it is a very successful 2 days conference, and it will, for us, it means the basis for consultation on our part to develop our strategy on vaccines in Africa. Thank you very much.
Thank you very much, Commissioner Amira, for that a very succinct brief on outlining some of the outcomes of the conference that was being held from yesterday until today. And as we said, it was a virtual conference to discuss the Africa's leadership in the development of a COVID-19 vaccine, as well as access to that vaccine. Now we move into the section of your questions, our Q&A session. I will start with a question from U1, and U1 is writing from the People's Daily Africa and says, my questions to Dr. Nkengasong. And there are two questions. China will make its coronavirus vaccine a global public good once it is available. And this is according to Chinese President Xi Jinping in a speech to the 73rd session of the World Health Assembly. And also at the extraordinary China-Africa Summit on Solidarity Against COVID-19, President Xi reiterated that China would provide vaccines for the COVID-19 to African countries. Several COVID-19 vaccines have completed phase 2 clinical trials in China. Is it possible to do the phase 3 clinical trials in some African countries? And he goes on to say, I know that there are clinical trials going on in South Africa with the cooperation of Oxford University, and that this is now undergoing. The second part of that question is, what principles should these trials obey? And they go on to recall that a French doctor suggested that Africa should become a testing ground for a COVID-19 vaccine, and that this prompted outrage in many African countries. So how to protect Africa against these sorts of trials? So these are the two questions coming from you, one from People's Daily Africa.
So thank you for those very good questions. I think we have just a few weeks ago, 2 weeks ago, we did sign and publish a statement jointly, I think we meaning the globe, including the chairperson of the African Union Commission, statement calling for the people's vaccine, which means we all have to consider vaccines against COVID as a global public good. So what the China president or China has stated is in line with that appeal, global appeal for COVID vaccines to be made a public good. And we welcome, of course, the pronouncements from the encouraging words from the president of China that make vaccines available to Africa as well. That is what we want to hear. And that was the underpinning of this particular meeting, was to be sure that our voices are heard and that we, Africa as a continent, is not placed at the back end. We welcome the trials of the phase 3 vaccine trials on the continent. We've also discussed extensively during this meeting that Africa cannot just be a passive participant in this. We have to be an active participant by taking part in both phase 1, phase 2, and phase 3 trials. We also heard and learned a lot during this vaccine conference from community experts that the beginning of access to and community engagement to build trust is to start trials in the community so that they see how it's done and they are part of it, and then they can advocate for the vaccines to be uptake when they become available. So not just phase 3, but all phases of trials should be conducted as well on the continent. As I indicated, it has been a very rich meeting yesterday. The CEO of the CEPI, a Coalition for Epidemic Preparedness Innovation, was here yesterday, spoke about the capacity building they are doing on the continent, and we will plan to engage them as well so that we work very closely. Dr. Seth Beckley from the CEO of Gavi was here this morning, and I think we have a common understanding from the various pronouncements they made that issues of access and equity are top on everybody's agenda. Let me just say that all vaccine trials on the continent will be conducted according to good clinical and laboratory practice. It's known. Those are standard principles that govern the vaccine trials, not just vaccine trials, but trials as a whole, both clinical trials for drugs as well as vaccine trials. I would like to assure the continent that this is not the first time that Africa is taking part and exercising leadership in vaccine trials. We've taken part in HIV trials in South Africa and other places. We've taken part in clinical trials of drugs in Africa, malaria trials across the continent. So there should be absolutely no doubt that we as the Africa CDC will be extremely vigilant to ensure that all trials are conducted by these common standards and international standards that are known across the world.
Thank you very much for that. We now move on to Sarah Jerving from Devex. And Sarah says, over the past 2 days, it was noted that some African nations are already producing vaccines. But will these existing manufacturing facilities be able to produce COVID-19 vaccines? Or are they already at capacity producing other vaccines? This is one question. The second question, will it be possible to produce a COVID-19 vaccine on the continent by 2021, or are we talking longer term? Question 2. Question 3, which countries are best positioned to produce a vaccine as quickly as possible?
I think that there are several countries in Africa that are already producing vaccines for other things. So let's be sure that we do not mystify vaccine production. It's the vaccine production itself is not a very complex process. I think I'm a virologist, so we know that how the vaccines are produced. Is how do you develop that, test them? I mean, developing a vaccine doesn't necessarily mean it will be a successful vaccine. So that is, I mean, as you heard yesterday, there's a large pool of vaccine candidates. That's the word candidate is used, that go into development, into the research and development, but very few actually meet the criteria that will go into the phase 1, phase 2, phase 3 trials. So I think there are several groups on the continent that produce vaccine, like the Pasteur Institute in Senegal produce from end-to-end yellow fever vaccines. There's a group in Egypt, South Africa, as well as even Ethiopia. I mean, so I think that there are several groups. And now, in order to repurpose those systems and apply them to COVID, you need capacity, human capacity development to develop, sequence those viruses, understand what they are, produce what they call messenger RNA, put them into the appropriate vectors and try them out there. So I think it requires a lot of capacity, a lot of capacity to do that, which of course we definitely need to do on the continent in order to be fit for purpose, to protect our continent. So with respect to COVID-19 vaccine in Africa before 2021, we should be optimistic, but cautiously so. It is very possible that what the world is going through, the pressure that we are all faced and challenges will make us have an accelerated vaccine. I will be very optimistic to say if we truly have a vaccine with the accelerated process we are seeing, you have that in December, which means the phase 3 trials that are currently going on now, which is a large-scale trial of about 30,000 people. You have to follow them for several months and monitor for efficacy. And so if you start now, which is June, and you follow them for 4 months or so, you break the code, you see what, if it's efficacious, then you project to December. If not, then you are in January or early 2021, if a vaccine works. Again, should be cautiously optimistic. We may have a vaccine for COVID-19. We may not have a vaccine for COVID-19. I think we have to be very, very sure. What has killed us, what really completely destabilized the field in HIV/AIDS was the unrealistic optimism that came in very early on that we have a vaccine. It's 40 years after we still don't have a vaccine against HIV. So I think as we approach COVID, we should be very, very careful that we do not raise false expectation. We'd rather work very hard. The accelerated principle, and I'll end it, is that as vaccines go into phase 3 trials, governments are already trying to purchase them and go to scale, which is a risky venture. That has never happened in history. Usually you finish a trial, you see that it's effective, and then you go into large-scale manufacturing. But countries are already in the process of going in for large-scale manufacturing so that if the vaccine becomes efficacious, then it's available immediately.
All right, we have a question coming from Peter Fabricius, and he is with the Daily Maverick in South Africa. He has 2 questions. He says, Dr. Nkengasong, after the vaccine conference, are you more confident that Africa will get access to a vaccine immediately after it's developed? Seth Barkley expressed concern that some rich countries are trying to corner the market. That's his first question. The second one is also, could you please give us the draft communique today? And I can respond to that one, that we will send you the draft, the finalized communique as soon as it is available. And also to inform you that if you go to the website, www.africacdc.org, you will be able to find highlights from yesterday. So as soon as these documents are available, they are being posted. So please keep checking. But we come back to the issue that he has raised about will the vaccine be immediately available as soon as it is developed?
So, thank you, Peter, for that question. And I stated yesterday, and I'd like to repeat today, and do that very deliberately, that the conference yesterday and today was all about the future of Africa, our own survival, as well as our economic survival. We all know that without an effective vaccine, our economies are going to be completely stalled. Our future is combat. So we cannot, as a continent, afford to be at the tail end of this. I say this because, I mean, I've been in this business for more than 30 years, and we saw what happened with the HIV drugs in 1996, where antiretroviral therapies were available in 1996. I remember we were at a meeting in Vancouver when they became available, but it took us until 2002, 2003 before they became affordable on the continent, or begin to be affordable on the continent. So that was about 6 years later. If we cannot afford as a continent to be lagging behind by even 2 years. So we have to make sure that this meeting, the conference yesterday and today is the beginning of a process and not the end of the process, which means this was not an academic exercise. We mean business as a continent. The president of South Africa, in his capacity as the chair of the African Union, and the African Union president will not be mobilized that much if they didn't feel that this was so important and this was the future of Africa. So I think we will continue. In the next coming weeks, we'll come out with a strategy and then a framework of implementation and engage you on very regular basis. We need to keep respect the promises that have been made and the pronouncement, but continue to focus as a continent on what is needed to ensure access and equity.
Okay, thank you very much. I understand that we have Simon, who's joining us online.
Can you hear me?
Yes, we can hear you, Simon.
Okay, this is Simon Akiba from Today News Africa in Washington, D.C. I was just wondering, the Trump administration issued a statement yesterday attacking China and saying that China wasn't really doing anything to support Africa. They talked about empty promises from China. So I was wondering what type of support does the Africa CDC receive from China in the development of the new vaccine? Thank you.
Yes, thank you. The African Union has many strategic partnerships, and for the development and establishment for Africa Center for Disease and Control and Prevention. In 2016, there was an MOU signed between China and the United States government. They signed between them an MOU that they will together support Africa for the establishment of the Africa Center for Disease Control and Prevention. And what happened after that is the two countries are supporting the establishment of Africa CDC. They're supporting us technically, providing us with experts, and also financially. And many private sector agencies in the two countries also are supporting Africa. So for us, the two partnerships are very important for the African Union. We are continuing with the two partnerships. We have frameworks that govern these two partnerships. Right now, while I'm speaking with you, we have experts from America and we have experts from China that are supporting us in the Africa CDC. And for the COVID-19 also fight, we have received support from China. We have received an in-kind support. China supported us with medical supplies, masks, ventilators, respirators, PPEs. We received in-kind support. We received also a financial support, around $2 million for the anti-COVID-19 response fund. So for us as Africa, we continue to need this partnership with the two countries, with China and with the United States of America. And we consider ourselves the partner to the two of them. And this partnership will continue in the areas I just mentioned. Thank you.
We move on now to Cara Anna, and she's with Associated Press. Thank you for this briefing. What new donations or acquisitions of testing materials can you announce? And what's the danger of a diagnostics shortage as the pandemic picks up speed in South Africa and in other countries?
So, thank you, Cara. The biggest news is what President Ramaphosa announced last week or 2 weeks ago, which was the platform, the Continental Platform, which was driven and supported by Strive Masiwa. And the platform is live, which means there's a lot of diagnostics on that platform. The countries can now go through that platform to access a PCR test as well as serologic tests. So that will begin to ease down the burden of access to diagnostics, which was a big challenge. As we speak earlier, I indicated that we've, as a continent, tested about 4 million people. We expect that number to increase significantly over the next coming weeks once the platform, once countries start using the platform to procure their diagnostics. So I think we've turned a corner with that, and we hope that now the challenge now is for countries to use the platform, which I strongly encourage all countries on the continent to start using the platform.
All right, we have Michael Omare from Tunacheki. Michael says, our question for today, he has 3 questions actually. Many states in the USA are experiencing significant resurgence in new COVID-19 cases. First question, do you think this will happen in Africa? Second question, is the Africa CDC preparing for this resurgence? And third question, what can Africa do to prevent it?
So very, very good questions and very pertinent questions. I just want to be extremely upfront with everybody that as we unlock the economies, we'll see a rapid increase in cases. And as we increase the level of testing, we'll see a large number of cases there. I think the whole purpose of lockdown was not to hide away from the virus, it was to allow governments time to put in place appropriate public health measures that include the testing, that include contact tracing and isolation, and include preparing our hospital systems for that. Have we done all of those? Yes, we've done some of that to an extent, but there's a lot of work to be done. So we'll we expect to see rapid increase in cases. But if you have those public health systems in place, then they allow you now to track where the new infections are happening and then do the same thing. Remember the initiative we have discussed in this forum many times, the PACT initiative, the Partnership to Accelerate COVID Testing, which is underpinned by the ability to test, to trace, and to treat. So I think with that is, as you unlock the economies, the testing becomes part of the economy itself. Secondly, with respect to Africa CDC's preparedness, we can never be prepared enough, but we are doing everything possible to continue to provide guidance to the countries on what they should do. We have no vaccine, that's why we have this meeting the last 2 days, nor do we have drugs. So we continue to rely only on public health measures so that they can ensure that it is done appropriately. So I think we have to have that in mind, that we will not relent on advising countries and providing guidance on which public health measures to put in place and to preserve them. Are we concerned that we may see this resurgence like in the United States? Of course, when you unlock the economies and people start moving freely and trying to do business, then we get ourselves into that space of balancing between saving lives and saving livelihoods. And we cannot, it's neither this or that. It has to be both. We have to work hard to save lives and also save the economies.
Thank you very much. That was perhaps our second from last question. I can see that my producer is typing in another question onto my WhatsApp link. Let me just wait to receive that. Just give us 1 minute. All right, it was a reminder that if you want to ask your questions, please raise your hand. I am not seeing any hands that are raised on this platform. And I am also not receiving any further questions on WhatsApp.
Peter Fabricius.
Peter, I think I read your question, unless if you have another one. Peter?
Hi, may I speak?
Yes, please.
Just if I may just ask a follow-up really to my question, Dr. John. Can you give us a little bit more detail about the efforts which Seth Barkley was referring to by certain rich countries to corner the market? In other words, to, as he said, to buy up in advance, vast quantities of vaccine, which would leave very little for the developing world generally and for Africa. And he said we need to rapidly respond to that. And I'm wondering how one does that.
I think the key for us is to make sure our voices are heard, and in all fora, we have to express ourselves as a continent and collectively, because that is what is going to give us that force and use the full weight of the African Union. And that is why the chairperson of the African Union Commission himself was on this meeting, and is also signatory to the People's Vaccine. We cannot make this an event. This has to be a process, and we count on everybody, including you in the media, to help us in this fight. We have to take the promises and commitments that are made in public the way they are, recognize them, appreciate them, but make sure that we state our own, we aspire for our continent ourselves. I don't think that we can relent on that. And as an Africa CDC and a technical arm of the African Union Commission, that is exactly what we have to do, and do that with you, the media, as much as possible. So you heard it from Seth Berkley yourself. I think we know that countries are out there, and they have the right. I mean, everybody, it is the responsibility of every member state to protect its citizens. But what we are saying is that this is a global problem. COVID-19, anywhere in the world, will continue to be a threat everywhere in the world. This is not just a slogan. It is the first time in 100 years that we are faced with such a threat that is affecting close to 8 billion people at the same time. So I think that discussion, the dynamics has to change. HIV/AIDS was a pandemic, but the stakes were very different, because I mean the prevalence was very low in developed world. It was massive in developing countries. COVID-19 is affecting everybody. So I think we expect to see that if global solidarity is not expressed, and the global understanding that this is a global problem and a global risk for everybody, then we'll continue to make mistakes.
If I can add to this, Dr. John, that in our past experience, and the continuing cooperation between us and Gavi, they proved themselves in this partnership with Africa. We are part of their policies on immunization of children, on vaccines for HIV, TB, malaria, they are supporting our member states, and they are working with us in the African Union. We were part of this replenishment summit just being held at the beginning of this month for Gavi, and we congratulated them. Our heads of states were part of this, and this partnership, it assures us that we will continue on the same partnership in the future. They will be considering Africa when a vaccine is developed. And they gave their commitments, and as been said by Dr. John, we will start the process immediately after this conference, as one of the outcomes of this conference, that we are developing our strategy on the development of vaccines for Africa, but we will be continuing the conversation with Gavi and all the manufacturers to make sure that Africa will not be left behind if a vaccine is developed. Thank you.
Thank you very much, Commissioner. Let me thank you for joining us for this press briefing. We do not have any more questions that are coming in, so it is time that we wrap this up. I want also to thank Dr. John Nkengasong, the Director of the Africa CDC, and also to thank you very much, colleagues who are online, for staying up with us until this late. It is quite late in Addis. Not really very late, it's nearly 7 o'clock, but normally during our usual press conferences, we should have been finished a few hours ago. So thank you very much for your patience. For those who joined us live on the conference, the virtual two-day conference, thank you again for your continued interest in this subject. Before we leave, I just want to give you the website address, because Commissioner mentioned earlier on about a fundraising project that the African Union is undertaking. There is a website that is supporting that fundraising drive, and it is www.au.africa. .int/AU COVID-19 Response Fund. So if you need any details about that fundraising drive, you can go to that address and you can get all the information that you require. Once again, thank you very much. We will be joining you again next week. Next week from our brand new press briefing room. We have done a little bit of touch-ups here and there in that room, and we look forward to you joining us again next week. Thank you very much.
Thank you. Thank you, Win.
Thank you. Thank you very much. Thank you.
Wow.